What do you think PA stands for?
Like Pennsylvania, like state of Pennsylvania, I think.
Private attorney. Prior authorization.
It's like the same thing as a medical assistant, right?
PA, like a physician's assistant? Like the person that gets you coffee?
Hi, my name is Morgan. I believe a physician assistant can do a lot of the same functions as a nurse, but they can also do some other tasks under the supervision of a doctor.
Hi, my name is Angela Petrosky. I'm a physician assistant and I work in Pennsylvania.
Hi, my name is Allie. I'm a trauma and acute care surgery physician assistant.
My name is Bridget Caquano. I specialize in orthopedic spine surgery.
My name is Virginia Flores, and I'm a PA specializing in urgent care, and I work at a PA-owned urgent care.
My personal favorite is, well, there's two of them. One is after you're done with like everything, interviewing them, telling them the plan, doing your physical exam, everything. They're like, so am I seeing a doctor today?
The common question is, when do I get to see the doctor?
Do I still get to see the doctor?
Some of the difficult questions I get from my patients are if I'm the one who should be repairing their laceration, placing or removing chest tubes, or removing their drains post-operatively before they go home. I reassure them that I'm adequately trained to do these procedures. We do them quite often in the hospital. And if there's any concern or it's a complex situation, I'm happy to have my attending physician accompany me for this procedure.
One of the most common and difficult questions I receive is, can I see the doctor today? A lot of the times the doctor is not available, and this can leave patients a little disappointed. And a lot of times they're not clear on what your role is and that you can help them the same way that the doctor would be able to help them.
I think the most difficult question that I get from patients regarding the PA profession has a lot to do with answering questions about scope and then also comparing us to other providers such as nurse practitioners or doctors. My favorite part of being a PA is probably what a lot of us are going to say, making people feel better, but also a big part of it is I really enjoy the detective work, figuring out what's wrong with them and then the best way to make them feel better.
My favorite part about working as a PA is working with such a great team. Coming out as a new grad, it's really nice to have people to bounce ideas off of and be there for support.
Probably the flexibility that we have in terms of hours, and then also in my specialty specifically, we're very like independent, so that's really nice. You have a doc there if you need anything or want to bounce ideas off of, but otherwise super independent.
The best part about being a PA is the variety it brings to each workday. Between being in the clinic and the operating room, no 2 days are the same, and it really keeps me on my toes, which I love. I also love the flexibility it brings to my everyday life. I'm able to make my own clinic schedule, which is awesome, and I have time to do my own hobbies and travel outside of work.
I've been a physician assistant for almost, 16 years now, 17 years actually. I have worked in multiple specialties throughout my career. I have worked in GI and in the ER and in neurosurgery, and now I work in physical medicine and rehab. I decided to be a PA because I loved the flexibility of being a PA. I knew going on and early on that I probably wouldn't stay in the same specialty for my entire career. I like to be able to switch and do things that are different and to have different experiences and to learn new things. And so that's why I decided to be a PA initially. I've always loved medicine and kind of got introduced to the career in college, and then decided to do that.
Something I wish people knew is that as a PA, we are always working for our patients. In the hospital, it may seem like things move very slowly, but after rounds, we are constantly putting in orders, documenting, seeing new consults, and discussing with nursing throughout the day to make sure our patients are taken care of. So even though you may not see us face to face, we are always thinking about you.
Our role in the healthcare system can be a little confusing to our patients. I think if my patients knew that my role in the clinic was identical to my supervising physician's role, this would make things a little more clear for them. Just like my physician, I can review imaging with you, I can do procedures, and I can also book your surgery.
What I wish patients better understood about the PA profession is that we're not here to be in competition with other providers, and we chose this career specifically to be a PA, not to eventually be a doctor.
Probably that it's not easy. I think it might be a little easier now, I will say, only because there's more schools and programs. There wasn't much of that when I was around, or when I was coming up, I guess, in school and stuff. When I was in college and applying to PA school, there was only 5 programs in Ohio. It's a lot more and more opportunity now. But it's hard. We do a lot of the things that med students do in a shorter amount of time. So I would like them to know that it's not an easier path.
Yeah, like an easy.
Having strong communication skills is huge when working in an interdisciplinary team. I also believe being empathetic is huge for understanding and connecting with your patients.
I think the most essential skill that you can have to be a good PA is not only the ability to listen to your patients, but also the humility to know that it's okay to not know everything right away and to ask for help.
Some qualities that make a great PA are having good communication, to be able to admit when you don't know something and go look it up if you don't, and being able to ask for help. Some of these patients are really complex, so it's okay to ask for help so you can provide the best care and build trust within your team. Also, being open-minded. This starts all the way in your pre-PA years when you're doing your patient care hours, into PA school when you're getting your clinical rotations in. You truly have something to learn from each of those experiences, and down the road in your career. We are lifelong learners, so you never know what the next opportunity will bring, and just enjoy it.
I think one of the things that is a bit of a misconception among patients is that PAs aren't well trained, and PAs are exceptionally well trained. We go through a very rigorous curriculum. We have to become certified nationally and licensed in any state that we work in, and as a result of that, we're very capable of taking care of our patients alongside of the physicians that we work with. I'm able to evaluate a patient, diagnose a patient, order prescriptions or laboratories for that patient, and make decisions about their treatment options, including writing prescriptions or providing an injection or referring them to surgery. So I'm an integral part of the patient interaction here.